Hi everyone, my name is Gülin Yilmaz. I'm the head of product at Stork Club. I lead our platform and clinical product teams to implement strategic and clinically informed initiatives. My expertise is in value-based fertility and maternity care. Today, it is my pleasure to moderate this panel of distinguished leaders in doula care, Dr. Ellen Tilden, Tracie Collins, and Jessie Raymer. Let's do a round of introductions. Dr. Tilden, let's start with you.
Thank you, Gülin. It's a pleasure to be here with all of you. I've been a nurse midwife for 23 years now, caring for women and families during pregnancy, birth, and the postpartum, working both in community hospital settings and also university hospital settings and federally qualified health centers. I am also a policy-oriented clinical scientist. I have 3 years of NIH-supported women's health postdoctoral research training. I'm an associate professor in the schools of nursing and medicine at Oregon Health and Science University in Portland, Oregon, a fellow in the American Academy of Nursing, and I am the director of maternity care at Stork Club. My scholarship is focused on interdisciplinary science, leadership, and innovation for perinatal systems change to improve maternal health broadly, but also to shift how care is delivered to decrease maternal morbidity and mortality so that childbirth is safer for all, but also equitable.
Thank you, Dr. Tilden. Tracie.
Hi, everyone. Thank you so much for having me here today. My name is Tracie Collins. I am the CEO and the founder of the National Black Doulas Association. I have 23 years in the field. I started out as a doula in the year 2000, and I transitioned into direct care midwifery. I brought everything that I learned as a midwife back into the field in the year of 2012, and I founded the National Black Doulas Association in 2017 with one simple question of having to help mitigate the Black maternal death rate in this country and how to do that, and also to elevate and amplify Black and BIPOC birthing professionals and make it a more pay equitable space for all.
Thank you for joining us, Tracie. And Jessie.
Hello, everybody. I'm so glad to be here. My name is Jessie Raymer, and I've been a doula for 30 years and an international doula trainer for 20 years. And the last 10 years I've spent really focused on the integration of doulas into creating systemic change on a national level through Medicaid, through employer reimbursement models, and commercial reimbursement models. So I'm very happy to be here. I'm the founder of Mother to Birth International, and also I am the Doula Network Coordinator for Stork Club.
Thank you for being here, Jessie. Before we start the panel discussion, I would like to give a quick overview of Stork Club. Stork Club is an innovative, inclusive, and comprehensive family building platform serving the members of self-insured employers. Its services start with preconception education, includes assistive reproductive technologies such as IUI and IVF services, support throughout pregnancy, childbirth, and postpartum, and extends all the way to menopause and hormone replacement therapies. Today, we will explore the impact of doula care on diverse populations. Dr. Tilden, I would like to kick off our discussion with you. We know that there is strong evidence that working with a birth doula can reduce childbirth complications and improve care coordination, reducing the utilization of medical interventions such as C-sections and improving neonatal outcomes such as preterm birth rates. Can you please describe the evidence and benefit of working with a birth doula?
Thanks, Gülin. Great question. The doula care has been studied for going on about 40 years. And so for certain outcomes, we have a really nice cumulative body of research on the model. The strongest evidence at this point in the literature demonstrates that doula care supports safe decrease in cesarean rates. And safely decreasing cesareans leads both to better outcomes for the birthing person or the mother and her baby immediately, but also improves that individual woman's health over her reproductive years and moving forward. So for example, recent research using Medicaid medical claims from 3 states to compare maternal outcomes of those who receive doula care that were propensity score matched to those who did not suggests that doula care resulted in a nearly 53% decrease risk of cesarean in those groups. Mm-hmm. The other areas and outcomes where we have stronger research is that doula care is associated with shorter time in labor and also less need for pain medication during labor. And there's also a number of outcomes that have been more recently linked to doula care and I think are still areas to explore. Emerging evidence suggests doula care is associated with, as you mentioned, lower preterm birth rates, higher birth weights for babies, improved breastfeeding initiation, also a reduction in perinatal depression. That study that I just mentioned that looked at Medicaid bills and payer and outcomes in 3 states showed a really significant improvement in lower risk for postpartum depression for those who receive doula care, and also greater satisfaction with childbirth experience. So, and to date, no research has identified that receiving doula care increases risk for either the laboring person, pregnant person, or for their children. I would add, however, that the benefit of working with a doula includes this, but actually goes beyond this science. And I think as my colleagues, Tracie and Jessie will likely describe in more detail, the benefits of working with a doula goes far beyond what we are currently measuring. So to start describing those broader benefits, I'd offer that doula care is fundamentally relationship-centered and person-centered care that is respectfully meets many of the emotional support and informational needs of the pregnant person and their family. So the measurable benefits of those aspects of doula care can be a little harder to capture with quantitative research, but I know from my clinical work and my many years of working very closely with doulas that these are absolutely elements of what's happening and maybe actually driving some of the other outcomes we're able to measure. And I think right now we're in a really creative time of exploring how we might better design studies to demonstrate some of these outcomes.
Mm-hmm. Thank you, Dr. Tilden. Very encouraging indeed. Tracie, what challenges do minority populations, and in particular BIPOC moms, face today with regards to maternal health and neonatal care? And we are very interested in hearing your description of the evidence and benefits of working with a doula, again, specifically for the BIPOC population.
Thank you so much, Gulen. Well, I'll start with the latter question first. The evidence, unfortunately, is inconclusive simply because it has only been recently determined as a public health crisis. So the numbers and the statistics with the data are not there yet in full because it's just recently been determined. Unlike the fetal death when it comes to African-American babies in the first year of life, which is attributed to preterm delivery. So as far as access to doulas in reference to the BIPOC community, it's really centered around education, information, access, and resources that really determines the level of the usage of a doula. And we do know that Black women really hire doulas not as a status quo, but simply because they want to live, because they understand the obstacles that they face in Western medicine and working with medical professionals that don't hear their concerns and take their desires seriously. So they really hire birth doulas and doulas overall so they can live, and that helps them navigate through the bureaucracy of Western medicine.
Thank you, Tracie. Jessie, how do doulas provide the necessary education and information to people who are starting their family planning journey?
Thank you for that question. I just want to first honor Tracie's comments because I think that this is reflective of the challenges we have overall in our system, which is how do individuals navigate the healthcare system to address their personal needs and which impacts their outcomes, of course. So for doulas, traditionally doulas are embedded in the community. We are community-based. We have deep connections in terms of the lived experience in the community. And so our primary goal is to be focused on our clients' needs. And so we're trained in how to seek out evidence-based resources. We also have a focus of really giving personal care to the physical, informational, and emotional support to families. So that means being a liaison to a lot of community experts in the community that would help families, and mostly helping families to understand and sort through all the different elements by having the power of a question, being empowered to ask questions. And we're not the overall fix, but we definitely are going to be a component to helping to ask those primary questions that are important to their unique needs. So evidence-based practice, we're trained in advocacy, and we're trained to be the eyes and ears. We're often the only person that sees their entire journey. So being with them from the beginning, prenatally, all the way through into their postpartum in their home through the birth itself.
Yeah. And building on your last point, Jessie, and on Tracie's comment on the fact that Black people are hiring doulas to live, which is their basic need, right? How sad. How do doulas serve minority populations' needs differently than they would serve, let's say, white populations? What is different?
Is that question to me?
Yes, that's the question. That's the question to you, Jessie.
Yeah. I mean, culturally concordant care, we have the studies to show that culturally concordant care has impact. That when someone that has your lived experience, whether it's as a peer or someone that, you know, if we have an individual who walks in and they are the same color as you, they've had the same somewhat lived experience as you, that they will understand how to care for you better. We have those statistics in terms of impact in looking at newborns care and looking at individual care. So that culturally concordant care means basically I've had the lived experience to know how to be and support you and make you a primary, concern of mine. So that's one area where I think that doulas are having impact, but it is a systemic issue. We have to look at that overall. And so it's baked into our system, and we really need to be able to have the opportunity to acknowledge that on every care level, not just the doula level for all of obstetrics.
Absolutely. And Tracie, would you like to add anything to this question?
Actually, I completely agree with what Jessie just said. I mean, it is really culturally centered in having those lived and shared experiences and with that intersectionality. That's also what we're seeing when it comes to not only Black and BIPOC people, but Black and BIPOC people who also happen to be in the LGBTQIA community, and having that level of representation and also advocacy in the time of expanding your family or going through the childbirth process. It's imperative.
Thank you. Shifting our conversation towards our employers and their members a little bit, and I have this question for all our panelists, starting with Dr. Tilding. Why do you think employers should offer a doula solution to their employees?
Oh, yeah. Well, I would say, Gulin, to put very simply, doulas are associated with better maternal child health outcomes, higher patient satisfaction and experience of support, a model of care with evidence for improving health equity. And I think my guess is in the next 5 years, we're going to have more and more evidence demonstrating that. But all of this is really, if you look at us, it's at lower cost. Yeah. So I think it really meets, in some ways, Berwick's triple aim of, improved healthcare. What can we do to have higher quality and also pay less? So that is, in a nutshell, why I think that should be of interest to employers. And I'll add that my doula work prior to 2022 predominantly focused on cost effectiveness of doula care from a population health lens, considering predominantly like Medicaid costs and reimbursement. And when Stork approached me this time last year and asked me to develop a doula care model for them and then lead a pilot study of the model, one of the key reasons I acted on this opportunity is that pregnancy, birth, and maternal health care in our country is truly a mess. I actually just looking over here because yesterday the World Health Organization released a report on trends in maternal mortality. And I'm going to briefly read one sentence from it. They did an international examination of maternal mortality from 2000 to 2020. And the US is one of only 8 countries where we have an increase in maternal mortality over these 20 years. And we are actually one of the worst. So it says in 2 regions, Europe and Northern America, Latin America and the Caribbean, there were significant increases in the maternal mortality rate between 2016 and 2020. The maternal mortality rate increased in Europe and Northern America with a change of about 16%, and in Latin America with a change of about 14%. When they listed out the countries that have these jumps, the order of the worst outcomes to better, it's Bolivia, Venezuela, Cyprus, Greece, United States, Puerto Rico, Belize, and the Dominican Republic. So we are one of the most dangerous countries to birth in overall in the world. And the danger is higher, much higher for Black and Indigenous women in particular. Mm-hmm. So we have a crisis, and we need bold, visionary, and smart ways of approaching these problems. And I see that there's power within industry to help define quality and also advance rapid solutions. And these capacities, I am firmly in the clinical care, I am firmly in academia, but I think that we need these kinds of capacities that industry is used to and industry functions with, maybe exactly what current public health systems and academic approaches need to spark the kinds of meaningful and sustainable changes to improve these issues. So anyway, that's all to say I said yes to Stork Club and led the doula study in collaboration with several of my colleagues here on this call. And to briefly share what we found, we recruited doulas and the pregnant people they were caring for between March of last year and July. We had 105 doulas who participated across the country, and then 205 people that they cared for during, pregnancy, labor, and postpartum. We surveyed mostly the doulas, but we also asked for some input from the childbearing people. And we surveyed about labor, birth, early postpartum, and then we asked people what their perception of doula care was about 4 weeks after birth. And our findings were directly in line with many of the prior studies. So perinatal outcomes among those who participated in the Stork Club doula pilot were better than national targets and demonstrated overall reassuring information about neonatal well-being. So for example, the national rate of cesarean is 32.1% right now. The Stork Club doula care participants, their cesarean rate was 17.6%. National preterm birth rate is 10.5%. Those who received Stork Club doula care had a 4.4% preterm birth rate. And our early breastfeeding outcomes were also slightly better.
Thank you very much for this very informative response, Dr. Tilden. It is quite shocking to hear how bad the clinical outcomes are in the United States compared to the rest of the world. And also to add to that, it is the #1 most expensive country in the world, 40% more expensive than Switzerland, which is the most expensive country in the world in anything else to give birth. So these outcomes come at a very high cost. Tracie, I have the same question for you. Why do you think employers should offer reimbursement to their employers for doula services, and perhaps with a diversity, equity, inclusion, or BIPOC lens?
Well, I like to look at it from an employee retention rate. Making sure that your employees are taken care of is one good way to increase employee retention as an employer. And how do you do that is in being able to support your employees during their time of childbearing. And so making sure that that is looked at, that is beneficial to not only the birthing family, but also the company overall itself. And it creates a better morale overall for employee morale when it comes to working within a company that offers that. And then also access to support. It is very layered. It's not one-dimensional. Doulas are not the solution for all. So having that employer support behind you, it just only amplifies the chances of survival when we talk about doula care, especially as it pertains to Black and BIPOC people. So again, it goes back to access to being able to integrate the level of doula support into the services, and knowing that your employer is backing you.
Thank you, Tracie. And Jessie, I have the same question for you.
Mm-hmm. Well, I want to echo the human rights component that Tracie and Ellen have pointed out, that this is simply a human right to have safe and equitable birth support throughout their process, and that every individual who's in the birthing childbearing year is often at their peak in their employment years as well. And so it makes economic sense for employers to really take the lead in this process, because we do know from the statistics and the studies that a healthier birth outcome leads to faster recovery, leads to faster mental health, return to work, etc. So there is a through line there. That's a conversation that could be had at a different webinar about the overall process in terms of happiness, well-being, and returning to work as a whole person. Granted, a changed person once you introduce children and newborns, priorities shift. The other piece I really want to highlight is it's a competitive advantage. I've worked in Medicaid now in our state, in one state in particular, that was Oregon, was one of the forefronts in the Medicaid model over 10 years ago. We are still puddling along at the pace of state mechanisms to try to implement a system change in that regard. Whereas what we see in the realm of working with employers is that you want answers now. And so the nimbleness of the commercial environment for employers to step up and be in the forefront for this particular topic, to be able to respond in a much faster way on behalf of their current employees and their own companies.
Thank you, Jessie. Coming back to an earlier point in the discussion, I would like to ask the following question to Tracie. How does the doula's own background come into play while serving minoritized communities? So the context within which I'm asking this is the following. When we're building thanks to Jessie's help, our own national doula network, we went out of our way to have BIPOC representation, and we strongly believe that the outcomes will be better due to that. But we don't necessarily understand all the mechanisms that goes into it. So I would love to hear a little bit more from you, how the doula's own background and shared experiences come into play while supporting BIPOC moms.
Well, as we all know, representation matters. And I think since we all feel the same consensus, the year of 2020 really shifted everything for everybody from a global standpoint. And the doula world was no exception to that. So what we're seeing now at the NBDA are more Black and BIPOC doulas coming forward saying, I want to help, I want to be a part of, I want to help save my community. And we all know that Black women have always been on the forefront of change as it comes to, this country. So childbirth is no exception of that. So the more that we amplify and then put Black doulas in particular in position of being equitably compensated, then we will also see the level of care and the access to doula services being shared across the board. It is no longer about classism. It is about a human right, as Jessie said earlier, and that is the area and the angle that we've always addressed it from. So we are glad to see the movement finally shifting, however slow in progress it may be. But it is the representation. And then also let me make this point. Unfortunately, being a Black woman, it doesn't necessarily mean that the best care I'm going to receive is going to be from a Black person. However, we want to make sure that they are in position to have choices and options and not just take what has been handed out. And it always comes at the death and destruction of Black women first and foremost. And we want to make sure that we're getting ahead of that.
Thank you, Tracie. Jessie, coming back to you, how does one identify and select a doula?
Mm-hmm. We talked about earlier how the doula connection is often very personal. This is people's individual journeys through the obstetrical environment through their childbearing year is often not so personal. They might be in managed care. They might not have an individual person that they're connected to. They'll see a lot of different people in a little siloed experiences. So the doula is an individual who is going to travel with them prenatally, through the birth, and into postpartum. So that's a very personal choice. So the first thing we always suggest is that, all things aside, check that personality fit. Is this a person you feel like you could be vulnerable with, could share those things? Sometimes I joke it's like your best friend with benefits, like that person you feel like you could be intimate with throughout all those parts of the journey. Also because that would allow the individual doula to be an advocate for them. And so doulas are highly trained in everything from anatomy and physiology to mental health and well-being to what kinds of interventions might be a part of the journey. And they're from the non-clinical perspective. Again, it's from the perspective of how to assist somebody through this process and ask questions that are important to them and still stay centered and focused. So asking about their training, being well vetted, which I really appreciate about the Stork Club program, is that it's a program built on vetting highly professional certified doulas, so that all the only other additional choices, access to availability of the doula, and then if they're available from their specific window of time when they're going to be birthing, and then that personality fit, someone they feel most comfortable with.
Thank you, Jessie. Shifting our conversation to something that you've alluded to, Dr. Tilden, and Jessie and Tracie, you as well, as doulas being part of the solution, but not being the solution. There needs to be a systemic change. So then I would like to ask, is offering doula support enough to meaningfully improve maternity outcomes, or do we need a more systematic change? My question is to all our panelists, starting with Dr. Tilden.
So I would say that doula care is one of the best researched models in maternity care solutions that has shown strong efficacy. And so it makes absolute sense for me that that there are people, us and others, who are really interested in how we can widen and strengthen this model of care and increase access for people. And then, as Tracie mentioned, create systems that are sustainable for doulas. A lot of doulas are struggling in systems in which they're not incorporated in a way that makes reimbursement and sustainability normalized the way it does for a nurse midwife, for example. So we have some really big opportunities and some big challenges. That said, doula care is absolutely not the only piece that needs to move forward. We know, for example, that we need a bigger midwifery workforce, and we need to decrease barriers to accessing midwives. We know that high-resource countries with the best outcomes in our world have the majority of care delivered by midwives. Healthier, lower-risk people get midwifery care. People with higher risk needs get the kind of more intensive, pathology-focused training that a physician brings to the table. Very important to have those be complementary rather than competing against each other, which is how it is in the US right now. We also need care that widely addresses social determinants of health, including history of trauma, that we are just beginning to put have a better understanding, a deeper understanding of how those things impact health outcomes, and we need a system that's ready to recognize and act on those. And I guess the last piece I'd offer, and then I'm eager to hear what Tracie and Jessie have to say, is I think we also need a big shift in terms of how postpartum care is delivered. Currently, once the baby is out, it's kind of like the mom is. Allison Stube, who's worked on this quite a bit, she's an OB in North Carolina. She had a presentation with a metaphor I love. She said, if you treat the woman who's just birthed as kind of the wrapper around the treat, which is the baby, once the baby's out, the entire system's focused on that baby's well-being. And the mom is kind of like given a handshake and a high five and is then really on her own, very much dependent on her community, her family community, to take care of her well or not. And that has consequences. So we need a massive rethinking of how postpartum care is delivered.
Thank you, Dr. Tilden. Tracie, what would you like to add? Systemic change that needs to happen for maternal outcomes.
I'm going to definitely piggyback on that fourth trimester. It is the most underestimated part in pregnancy. Pregnancy is gestational weeks of 40 weeks, and it's 10 months. And the majority of the rest of the healing or pregnancy time that we see in the doula world is postpartum, and that can be anywhere from a year to 2 years recovery. And we're not speaking about it from just a physical angle. And yes, the high five is given, and this is so essential when it comes to doula care, because the doula is going to look out for it. And not only are they trained to look out for the postpartum warning danger signs such as postpartum preeclampsia and embolism, things that can cost someone their life. And we see that happen time and time again as it pertains to Black women dying from childbirth-related complications. So if we really address and not just look at pregnancy from the gestational period, but really expanding that care and that lens to include postpartum more thoroughly, and then putting people in positions such as doulas and postpartum doulas specifically, because they have a tailor-focused lens when it comes to feeding and lactation and all of the other related complications that I just mentioned, to get addressed and the attention being sought and addressed to save a life. So I am going to we need more care-centered information, education, and access when it comes to that.
Thank you, Tracie. Jessie.
Oh, those are great points. So I'm going to add just a slightly different lens to the same conversation. But for me, it's about common sense childbirth. And I think of a midwife and Dr. Jenny Joseph, who's really founded a whole premise of that in Florida, where she has a clinic that says yes to everyone in a place where it's very hard to get access. And she's one example. We also have examples right here in my hometown of Portland, where we have a program that's called Project Nurture, and it's from a different at-risk population. It's for substance use disorder and pregnant people. But the approach is wraparound care, and the idea that if someone receives total wraparound care from the moment they enter the childbearing year, meaning they have all the resources they need, their housing is addressed, their food is addressed, they have their medical and mental health needs are met, and then they have this specific care around having a midwife, a peer counselor, a doula, a doctor, that are all there available to them, then they have better outcomes than well babies in our common system. And they have better outcomes in terms of keeping parents and babies together. And so we have examples in our system. That's where I would spark that element of hope, where we have produced them, but they're on demonstration levels. They're on one person's back saying, yes, hey, I'm raising a white flag over here to say, here's how we can do this better. We just have to be able to commit as a society to making that bigger. And I think this is a chance where we have that through collaboration within the system, not just the healthcare system, but also with commercial, with all the invested parties. That means employers and providers and healthcare systems coming together.
Thank you very much, Jessie. Yes, employers and the rest of the system are all in it in order to take these perhaps piloted or tested and trialed and systems in order to scale them to the rest of the country. I see that we also have a few questions from our audience. The first question is for Dr. Tilden and Tracie. How do doulas impact postpartum outcomes, which we just touched on, especially as it relates to maternal mental health? Dr. Tilden, would you like to kick us off?
Okay, happy to. So as I mentioned earlier, there are a few studies that are suggesting that there is a link between doula care and improved postpartum mental health. And building on what Tracie said, I think we're all communicating very similarly around the need to really think differently about postpartum care, and that how doulas might fit in as part of the solution in improving postpartum care, which Tracie so perfectly outlined. I think that we're going to see in that work, and I know Stork Club, my work with Stork Club, we're starting to explore how we might be able to contribute to that research, is what is the impact on the person's well-being as holistically in the postpartum period. One thing that I think, even though we don't have as much research, it's just emerging on doulas specifically, I'll mention that we have really robust research on the role of social support and improve maternal health, mental health, improve maternal mental health, and both depression and anxiety. And so given that we've got, 70 years of strong research showing that if that person who just birthed perceives high support, pragmatic support, emotional support, they get the support that lets them, someone hold the baby while they nap, get better rest, all of those things make an enormous difference in preventing mental health issues. And so given that a doula care can be seen actually as a form of support, I anticipate we're going to show some really strong links in the future. And I'm really eager and excited to be helping to drive that research forward.
Thank you, Dr. Tilden. Tracie, what would you like to add?
I want to add, like Jessie just mentioned earlier, the more common sense approach. What we do see in the Black community is that the care is not there from a communal standpoint. So maybe they don't have the necessary support from their family or don't have a large community within, their geographic region for whatever reason. So putting a postpartum doula in place or having access to information and that level of peer support, lactation support, all the things that are necessary and needed for that crucial time, it will help to minimize and not only strengthen the healing process, but it'll minimize any of the postpartum blues and or depression that we see in the Black and BIPOC community as it pertains to childbirth, so on the postpartum lens. So just to really piggyback off of what Dr. Tillman just said.
Thank you, Tracie. We have one more question from the audience. What is the future of doula care? Is it more regulations, better and inclusive reimbursement rates? Jessie, would you like to give us your opinion on what the doula care looks like in the future?
Thank you. Well, having been on this journey for 30 years, really since almost the formation of the professionalization, I mean, it's an age-old tradition. Since the dawn of giving birth, we've had caregivers and companions supporting individuals through the process. As we understand that, we really have been a grassroots profession from that start, as we started to care for other individuals in the community. So our future, where we are right now, is we're seeing a wave of Medicaid reimbursement state by state by state starting to formulate. That legislation is different in every state. We are also looking at commercial insurance that's coming our way. So one of the things that I see is we need to continue to advocate for sustainable doula reimbursement. That is a major feature, because up until a few years ago, and really still even now, only 6% of the population could access doula care through private pay. And definitely when interviewed through the Listening to Mothers studies, that would be 94%, 80% of everybody else wanted to have a doula, but just couldn't afford to have one. So, so we need to balance that recognition with the desire of, and the kind of I would say the spotlight that we've received now. And, doula care has been even noted on the obstetrical guidelines as being a value. We have to balance that with sustainability, meaning adequate reimbursement, because we put our whole selves into the process. We're on call, we go into the community, we're from the moment of hire, we're available to that client for many, many weeks or months. And so that's going to be a balance there, I think, because we're not going away, and we're definitely going to see ourselves kind of systemically brought into the system. So how do we do that in a way that maintains our profession, but also maintains adequate reimbursement to grow the workforce? Because it's a big task. Normally, doulas historically have had about a 2-year burnout because they're they're walking into people's intimate lives, and they have to be trauma informed, and they witness obstetrical violence, and they experience so many layers to what that might mean for them personally to not burn out. So we have to find that balance. And sometimes money is the lever that keeps us there. It's not what brings us there, but it can keep us there so we can afford to walk away from our own lives for 3 days plus at a time per birth. And I bet Tracie has an add-on to that.
Thank you, Jessie. And she's absolutely correct. More regulations. What we're seeing since COVID is the demand for certification, and hospitals are requiring that you are, not only hospitals, but insurance companies for reimbursement are requiring that level of certification, and they are very selective about who they are choosing to honor, the certifying bodies. So fortunately, we're seeing NBDA move up that ladder pretty quickly, but we're seeing a lot of requests and demand for proper training and evidence of that, documentation around that. And we're also seeing, demand for certification. So like Jessie said, it is an age-old practice, and pretty much since the beginning, even when I came into the field 23 years ago, certification wasn't necessary. So there are a lot of doulas who are operating not certified, and that has been how the field has operated for so long. But because of COVID and hospital regulations, and now insurance companies and possible reimbursement with Medicaid and private pay, with commercial pay insurance, that is what we're seeing the change coming in. So just encouraging those who are professionals, and especially BIPOC professionals, to continue moving forward towards certification after completing, the training necessary, but also looking at it from a state by state level, what's required, and then hopefully we'll be able to see some federal change in our lifetime.
Thank you, Tracie. I understand that we have more questions, and if we didn't get to your questions, we will get back to you in the next 3 business days. With this, I would love to move to closing remarks. Dr. Tilden, would you like to share your closing remarks with us?
Happy to. So, as I hope we've made really clear, U.S. mothers are dying now, and in particular, Black and Indigenous mothers are dying. And one of the complicated and frustrating truths about this, where we find ourselves as a country, is that we actually know what works to make a difference there. We know that doula care is part of the solution. We know that we get better outcomes when we match healthy pregnant people with midwives as their providers, within a system that can both quickly deliver higher acuity, like more interventive care when that's needed, but just as quickly recognize when the high acuity care is not needed and is actually harming people, and to decrease the interventiveness of the care. So a chance for an integrated system, across settings and across providers, we know that makes a difference. We know that actively working against racism in healthcare is part of the solution. And we know that it's greatly, this idea of greatly modifying postpartum care is part of the solution. So we actually know, a lot of what we need to fix, but we don't yet have the workflow, the payment structures that effectively shift perinatal care towards what works. And as Jessie mentioned, Medicaid solutions are definitely happening, and Jessie and I have worked in Oregon for over 10 years now, working on getting Oregon to make that change. And it's being mimicked in other states, but it's slow. And it's state level focused change. So we need to think much more creatively about this. So my job as a clinician and a scientist is to do everything I can to push maternal health workflow and payment structure toward what saves lives. And I know that widening sustainable access to doula care is a key part of what's needed. And I think all of you in the audience are in a really powerful position to help accomplish this. So it's my hope that we can work together to start realizing and implementing better solutions.
Thank you, Dr. Tilden. Tracie?
Listen to Black women. It's really simple to me. Just listen to Black women. We have always been on the forefront of change. And when a Black woman comes to you with concerns, listen to what she has to say, because she's coming from a place of lived experience. And my question is, do you really want to be a part of the change? And if so, how can you help set the tone and be a part of the example so we have a better society for all? This is a human rights issue. This is not isolated. And people need to realize, until Black women stop dying as it pertains to childbirth, then nobody is safe.
Thank you, Tracie. Jessie.
Thank you. I want to thank the audience for their time. It's 45 to an hour of precious time spent on this topic, and I really appreciate you holding the spotlight on these issues. For me, what gets me up every day over 30 years, day and night, and sometimes stay up for 24 hours, is the idea that we are here to create a culture of nurturing, and that to do that, we have to address a system that doesn't work for anybody. Most of my work has been spent as a doula in collaborative care with midwives and doctors in systems where that collaboration has been embedded into a program, where we've seen positive results. And what I've noticed is that this system doesn't work for anyone. It doesn't work for the humans involved. And so one of the #1 ways we can see that employers can address this is push for change on behalf of your companies, because we know that the money talks. And so that's really a piece where I like to see these conversations come together. And then, of course, because I'm a doula, I have to always quote and end with John Kennel of the World Health Organization. Early on in our profession said, if a doula were a drug, it would be unethical not to use a doula. So thank you for your time.
Thank you, Jessie. Dr. Tilden, Tracie, and Jessie, thank you for your valuable time and input in today's discussion. I would also like to thank the audience in joining us in advancing maternal health equity and outcomes. And we at Stork Club are committed to being part of the solution. Thank you, everyone, and have a good day.